think about this in your mind. A young girl with cerebral palsy and complex medical needs is taken away from her family because they can't take care of her. A teenage boy is discharged from a juvenile justice facility with autism, and his parents can't take care of his complex behavioral challenges and keep him safe and keep others safe. And then what about an 11-year-old with Down syndrome who loses all of their living relatives? These are just some examples of the kinds of kids with developmental disabilities that are served in Florida's foster care system every day. And even though all of these kids have a developmental disability, as you can hear just by those brief sentences, they all have very unique needs. There's a lot of services available to them, but navigating all the different systems of care is very complex, and so today we're going to try to help explain a little bit of it. My name is Lorena Fulcher, and I'm with the Agency for Persons with Disabilities, and today I'm brought armed with an attorney, Michael Savay, who's also with the Agency for Persons with Disabilities. And we're pretty laid back, so feel free to ask questions as we go. We like questions, so if you need clarification on anything. Okay, as you're advocating for kids with disabilities in foster care, there's a lot of life decisions that you may be involved in. So where does a kid with special needs live? Where can they get the medical treatment and therapies that they need? What if they have mental health issues? What if they have behavioral health issues? They get all these kinds of services, but figuring out who does what and when is very complicated. But one thing that we know is if we can connect kids with disabilities to the right services, it helps them meet their permanency goals and also helps them avoid group care. So acknowledging there's a lot of kids with different kinds of special needs, today we're going to narrow the focus a little bit and we're going to just talk about kids with developmental disabilities. So in Florida, developmental disabilities are defined in the Florida statutes, chapter 393. The screen is just a cut and paste of the definition in the statute. And there's some specific diagnoses people would have to have a developmental disability. People are typically born with a developmental disability, but the statute does require that they have it before the age of 18. And a developmental disability is something that is a substantial handicap that is expected to be ongoing for a lifetime. So the statute defines developmental disabilities, and then there's rules in Florida Administrative Code, and they kind of discuss what types of professionals can diagnose a developmental disability, what kinds of tests are acceptable, and to what extent the disability has, the severity of it, if you will. And so this definition is somewhat important because as you're assisting people in applying for services, there's different programs that have different eligibility criteria. Okay, as I mentioned before, there's a lot of agencies, state agencies, and then also private and nonprofits that help people with developmental disabilities in Florida. But there's so many, sometimes it's hard to figure out who does what. So we will talk a little bit about the government agencies that serve people with developmental disabilities, and then we'll also get into some of the non-governmental resources. Okay, so the Agency for Healthcare Administration is the single state agency that administers the Medicaid program for the state of Florida. And when you're helping kids with disabilities under the age of 21 that are Medicaid eligible, Medicaid is going to be the primary source of services for those kids. In particular, kids with developmental disabilities, they get their medical care and therapies and all kinds of supports through Medicaid. So even though AHCA is the single state Medicaid agency, there's different Medicaid programs that are administered and operated by other state agencies. So you have ACA, and they have managed care plans and Medicaid fee-for-service. You have Children's Medical Services, that's operated by the Department of Health. You have the Agency for Persons with Disabilities I-Budget Waiver, which is another Medicaid program. So these are just a few. So in the Medicaid program, states are required to offer a very wide range of services to people under 21. A lot of times when people turn 21, some of those services and supports drop off. But for kids, it's pretty substantial. And there's actually a federal law that mandates that kids get services through Medicaid when they're Medicaid eligible. It's called the EPSDT, and it's part of the Social Security Act. So it's for kids under 21. It's about matching them to medically necessary services, right service at the right time to the right child, and it's pretty broad. So in Florida, you've probably heard about the statewide managed care plan or managed medical assistance program. And through the statewide managed medical assistance program, kids are receiving their health care through a managed care plan. And so kids who are under 21 and Medicaid eligible, and that includes anyone in foster care, not only do they get their prescriptions and doctor visits through Medicaid, there's also a very broad range of services available depending on what they need. So for example, Medicaid provides nursing care. They provide home health services to kids who need it. That might be personal care type services, behavioral health services, dental care, occupational therapy, speech therapy, physical therapy. That's just part of a long list of some of the services that kids under 21 can get through the state Medicaid program. So children in foster care are typically receiving services through the Medicaid Child Welfare Specialty Plan, and that's one of the managed care plans, and it's operated by Sunshine Health. And I know I saw Sunshine Health here at the conference today, so I'm sure they have a lot more comprehensive information about what they cover. But that is a special plan just for kids in child welfare that offers these kinds of services when they're medically necessary. Children's Medical Services has another managed care plan, and they serve kids with certain complex medical conditions or chronic medical conditions. So not all kids are eligible for CMS or Children's Medical Services, but if you are helping a child that's already getting CMS services if they go into foster care, they can choose between those two specialty plans. Also, the Medicaid, yes? I think she asked about orthodontic services, and I think it's going to depend on the specific health plan and what they offer.
We're always told it's not covered, that the dentist has to say that it's medically necessary. We've always been fighting to get the orthodontist.
And that would be, right, and that would be essentially an ACA decision, because they have a dental services program, and so ACA they used to have like really detailed handbooks, coverage and service limitation handbooks. They've sort of boiled them down into policy statements. So there is a dental program policy handbook that ACA has set forth on their website, and it does spell out specifically what they will cover under what circumstances. As Lorena was saying before, though, with EPSDT, if you're able to tie it into that federal regulation, theoretically, coverage is possible. You just need to demonstrate that it's medically necessary. So the answer is not really clear-cut. The answer is it depends. It depends on the situation. It depends on the circumstances.
So, and some of the Medicaid program is still under the Medicaid fee-for-service, and so that means it's not under the managed care plan. So, some examples might be Medicaid fee-for-service recently started offering behavior analysis to kids under the age of 21. For a while, it was limited to kids with autism only, but now any kid who has medically necessary behavioral needs can get behavioral services through the Medicaid program. They go through a prior authorization process. Medical foster care is also an example of something that's part of fee-for-service Medicaid. Okay, so just to kind, yes?
Question, you had a parentheses underneath that last statement that said for APD.
Thank you for catching that. Medicaid fee-for-service, there are certain things that everyone is eligible for, but individuals who are clients of the Agency for Persons with Disabilities, meaning they're either on our waiver or waiting list, they are exempt from enrolling in a managed care plan. They may, if they want to, but they don't have to, whereas the general Medicaid population typically is all in managed care. So APD customers are exempt from managed care if they choose, and they can just do all their Medicaid services as fee-for-services. And so the individuals, their parents, their guardians, whoever's making life decisions, you know, that's just another thing to weigh out the pros and cons of service delivery for the kids. Yes?
Regarding behavioral analysts for children with behavioral needs, can you walk us through the process for the prior authorization and how it works? Because what we're finding is that it's very difficult to find providers. And is there somewhere we can go?
That's an excellent question. The new behavior analysis coverage with Medicaid, one thing they have been doing is an aggressive provider enrollment with the Agency for Healthcare Administration, and I know they're not done. So they are kind of still ramping up the program. So they are enrolling more providers. In general, a physician would prescribe the service, and then the behavior analysis for children through Medicaid has to be prior authorized. So the Agency for Healthcare Administration contracts with an organization called Beacon. And Beacon would be responsible for determining medical necessity and authorizing the behavioral services. So the first step would be getting the prescription and then going through the prior service authorization process that Medicaid has with Beacon. I know they have a lot of materials on their website about that process. A lot of it's geared towards providers to enroll. I haven't seen as much as I would like to see about, from the client perspective, about getting the services. But at the Agency for Persons with Disabilities, we have a lot of consumers that would potentially be involved. So over the next few months, as that program develops, we intend to send out as much information as possible to our caseworkers. So hopefully you'll hear more as it becomes known.
Do you know what was actually provided or what's paid for in home? Or in the office, the school? I know that's
I'm pretty sure they are offering it through a variety of settings, including in-home, and they have both the analyst level and then also the more direct care behavior assistant level. To the extent of all the ins and outs, I'm not an expert on that. Yes, sir.
The fourth option, the first, if I can just get clarification, you indicated if they're on the waiting list, they're eligible for the fourth option, correct? Not if they're on the list itself, but if they're also on the waiting list?
Yes, that's correct.
Can you give a basic summary of the pros and cons of choosing that fourth option instead of one of the standard plans?
It's really, I think it's going to depend on the child, their needs, what part of the state they live, and the availability of providers. So I really think it's it's very individualized, so I wouldn't be able to endorse one way or another. Do you have thoughts, Michael?
Yes. Just to add to that, so what we've seen for the clients that we have that are on the waiver that have opted, well, some do choose to go into managed care, and they've done that because the managed care plans will, in some instances, offer additional services, additional things that Medicaid fee-for-service doesn't offer. For individuals over 21, there are some managed care plans that offer adult dental services. Typically, dental ends at 21. Once the person is no longer a child anymore, they're an adult, that type of coverage is no longer available. So that's one benefit. But as Lorena said, it really comes down to provider network. They have differing provider networks, and sometimes there are pros and cons within that.
So the Child Welfare Specialty Plan and Children's Medical Services, these are part of managed care, but they're known as specialty plans. The one thing that's different about the specialty plans is that they offer care coordination, or case management for kids that have significant needs. So if you are working with a child that is in the Child Welfare Specialty Plan or in the CMS plan, it's helpful to engage the care coordinator or the case manager. I know Sunshine Health has specific case managers that will talk to the CBC case managers. With CMS, every kid has a care coordinator. The care coordinators are responsible for teaching, coordinating services, advocating and arranging visits with specialists, schools, community programs, healthcare facilities, choosing providers. So those are really good contacts in these specialty plans.
Okay, I'm up. So as you have come to know, we're with the Agency for Persons with Disabilities, and our agency's mission is to support persons with developmental disabilities in living, learning, and working in their communities. And that is our agency's goal, and our services that we offer move forward and forward that goal. When thinking about our agency, there are very specific disabilities that we are able to serve. And so this is really a refresher because this is a more higher level training among the disabilities. And so this is always fun because some people have a really hard time remembering all of them. I don't have a mnemonic, I just go through it alphabetically. So I will start with autism, cerebral palsy, Down syndrome, intellectual disability, Prader-Willi syndrome, Phelan-McDermid syndrome, and spina bifida. Recently, we were able to add Phelan-McDermid syndrome, which is a genetic abnormality, and all of these very specific developmental disabilities, that's the initial criteria to become a client of our agency. And we are only able to serve individuals that have one of those, or sometimes they have more than one of those developmental disabilities. It's really important to make an application with our agency, because sometimes when there is an individual that you all are working with and you have a suspicion and you come to us for like immediate assistance or advice, we're able to give it, but it's really helpful if when you have a suspicion that this child has a developmental disability, you make an application. You reach out to the local office and you can either request the application just by calling, or you can go to the APD website, which is apdcares.org, and pull the application off there. So also very noteworthy, so you're looking at these disabilities, and when you think about a disability, you think about, all right, it's a diagnosis. With our agency, it goes beyond just a diagnosis. There's very specific statutory criteria, and there's criteria in the Florida Administrative Code rules. So a diagnosis alone is insufficient to qualify to become a client of our agency. And as an example, we can talk about autism. When you think of autism, the Diagnostic Statistical Manual, we know that there's a spectrum. And with that spectrum, there are extremely high-functioning individuals, and there are extremely low-functioning individuals. for our program, we're only able to assist or make eligible someone who is very low functioning. Because when you think about the program that we administer, it's to provide home and community-based services to individuals that would prevent them from being institutionalized. So someone who has what was commonly referred to as high-functioning autism or Asperger's, that's not really someone who's going to be at risk of institutionalization. That's someone who can be very successful. So it's different. The services that we offer wouldn't necessarily benefit them to the extent that it would benefit someone who has a very severe type of autism and was very low functioning. Another example, with spina bifida. So there are different types of spina bifida, and depending on the degree of impairment, there's spina bifida cystica, spina bifida myelomelaingocele, which I cannot spell to save my life. The statute does for us, which is great. And then there's spina bifida occulta. And we are not able to serve individuals that have spina bifida occulta because that is a very mild form of spina bifida. So when you're looking at the different disabilities that we have and that we serve, it goes beyond just getting that diagnosis. There's rule criteria and statutory criteria that has to be followed. Yes.
Could it be with an ASD diagnosis that a child could qualify at one point and then possibly reach a point where he wouldn't qualify any longer for services?
That's a very intriguing question. So for autism, it has to be a pervasive, the symptoms have to be pervasive. So what we would be looking for in the different records would be showing that this is something that's ongoing. If there was suspicion that it was something temporary, then technically the psychologist that was reviewing it may err, and they wouldn't err, they would just not really make the person eligible because time would potentially show that they're not going to have this level of severity. The rule actually breaks down, there are different indicators or different criteria that has to be satisfied. And so for autism, it's a severe communication, learning, and behavioral disorder. So when you think about someone that has high-functioning autism, Asperger's, they're not necessarily going to have those severe behaviors, but they may have those severe communication-type issues that are happening. All right, so this is the APD regional map. Our regions are set up very similar to the Department of Children and Families. This is noteworthy and helpful because you all are spread out across the state, so you can look to this slide and see, well, which office you'd want to contact. This is also available on the agency's website, which is apdcares.org, and you'll be able to make contact to the local regional headquarters and get put in contact with whomever, if you have a question about applications and making an application, you can ask to speak to one of the waitlist staff. We are very often working with the Department of Children and Families, and I think with you all, and we're doing that. A lot of times there are things that are happening behind the scenes that you may not be aware of. In our region, we have quarterly calls, actually not in our region, statewide, there are quarterly calls with the Department of Children and Families, and they host these calls with the CBC, with CLS, with you all, to discuss the status of different clients that are being duly served. Beyond that, at the regional level, we host calls on a monthly basis, and similar parties are present. We're discussing things like, all right, there's a client that's going to be turning 18 in the next 6 months. We need to start going into transition planning. We need to see what's going to happen. Potentially the person's going to age out of foster care, traditional foster care. If there's someone that's going to be nearing permanency, that's something that's discussed. So that way, we're all on the same page with what's going on, and we can see and coordinate what our agency can do as well as what other agencies are able to do to make sure that this process is somewhat successful. Common issues that are raised are clients that are aging out, turning 18. If there's like a request for joint assistance where someone is saying, all right, we need to brainstorm about this particular issue, we do that. Also, if there are residential placement issues. So let's see. So our agency administers the iBudget waiver program. We've got over 33,000 clients currently enrolled in the waiver. And we have, unfortunately, a waiting list that has approximately 20,000 individuals. At this point, whenever anyone submits an application to the agency and we're able to make them eligible and determine that they're eligible, they are automatically added to the waiting list. We have been able to offer immediate enrollment for individuals that have applied under Phelan-McDermid syndrome, and the only reasoning behind that is because there was a special appropriation that let us do that. However, for everyone else, they're added to the waiting list. And when you think about this iBudget waiver, the whole purpose of the waiver, or among the many things the waiver does, is it provides home and community-based services. And these are services that are therapeutic in nature, among other things. And the waiver provides assistance to help the clients remain in the least restricted environment as possible. And that is our goal as an agency. We want to make sure that our clients are in the least restricted environment. Yes, ma'am.
So, with kids in foster care, and they apply while they're minors, they're on the wait list, they're not getting those services until they are moved up on the, this is my understanding of my case, they have to be in a crisis and gonna be homeless. So until that, they don't get those services, they have to be given through the foster care system, correct?
So yes, that is somewhat correct. There's language in the statute that allows the agency to prioritize and grant enrollment to children involved in the foster care system under specific circumstances, and we're going to actually cover that in a little bit. But traditionally, for everyone that's on the agency's waiting list, the only way that they're able to get off of the waiting list is either the legislature appropriates funds and we're able to do waitlist to waiver offers, or they have to meet the crisis enrollment requirements. And it's crisis as the Florida Administrative Code rules defines it, not just our own internal definition.
So how long does it take for that 20,000 person to get services?
Unfortunately, there's no direct way to answer that because the way our wait list is set up, the statute provides for prioritization, so we had to assign different priority categories to all of those 20,000, approximately 20,000 people. So the different priorities are based on what the circumstances are. So it's hard to answer. Someone who has a more severe situation, it would take less time. All right. So within the waiver, our clients are served not just in the family home, not just in residential facilities. They're also served in an environment that's known as supported living or independent living. And this all goes into the idea of we want our clients to be in the least restricted environment as possible. And that's how our services are set up. And not just our services, but they're also services that other agencies offer that are able to be provided in those different environments. And I'll touch on that a little bit more later. I think you had a question.
If something very recent came out, I want to say probably within the past 6 weeks, that evidently an agreement was reached between APD and the department, and I think the person that was responsible for brokering the agreement was Robert Layton's clinic, where there's an agreement now that anytime one of our children who's in foster care is in need of the services, they're going to move up on that wait list. Am I correct?
Yes, we're going to cover that. Yeah.
Okay, all right.
All right, so I'm gonna let you go.
That was
You
actually.
know what? I'm sorry.
Oh,
Just-
let,
One more slide, sorry. Okay, so next is the hierarchy of reimbursement. So Medicaid in general has this provision of Medicaid's the payer of last resort. For the Medicaid waiver, we also have a provision where we are the absolute payer of last resort. And I mean, I'm not standing up here to say to you, don't come to us. That's not the purpose. The purpose is, and hopefully at the end of this presentation, you're able to walk away with an understanding of there are other people that have responsibilities, or there are other agencies that have responsibilities to assist in serving these children. And that the way our system is set up, those different resources and sources of support have to be accessed first. And so just going through the hierarchy, we look at third-party payers. So if someone has the ability to pay private pay on their own, okay, that's something that should occur. Then we go to, all right, a lot of our clients have Medicare benefits, so we want to see, have they accessed those? What's more relevant to what you all are doing is other Medicaid programs. There's been talk about Medicaid state plan and these managed care programs. For individuals that are under 21, there are so many different services that are available. And I say it as so many because when you think about that federal requirement of EPSDT, that is very open-ended, very broad. Basically, medical necessity is the guiding force for what can and can't be approved through that. And that's something that occurs and would be authorized by the regular non-waiver Medicaid benefits. So when you're thinking of the children that you're serving and the different services or supports that you want to put in place, it's important to think, okay, well what can you get? So if you've got someone and you're trying to maintain them in the family home, and you have a client or an individual that has cerebral palsy and has, ambulation deficits, and the parents are requiring assistance because they have weakness and they're not able to do lifting and transferring because of some medical condition. Well, under Medicaid state plan, there is the availability of a service called personal care assistance. So when you're thinking about wraparound services or things that can help strengthen and maintain that particular environment that the client is living in or the individual is living in, you want to think about what are these other Medicaid programs that are available. So personal care assistance is something. There was conversation earlier, a question earlier about behavior analysis. Sadly, there is this shortage across the state of behavior analysts that are participating in the Medicaid program. And that is something that we're all trying to actively recruit to fix, but it's not necessarily working as fast as I think all of us would want it to. And when you are able to find a good behavior analyst, I mean, those types of services, behavior analysis and behavior assistance services are really helpful, not just in the family home setting or like an independent living setting, but also in a residential setting, because it helps train the different folks that are in the group home to understand the behaviors and to work on reducing them. So there's been a change. The Agency for Healthcare Administration previously authorized behavior analysis services to individuals that had a diagnosis of autism. They've now opened it up through an interpretation of EPSDT, so it can be for pretty much anyone as long as they're under 21 and the service is medically necessary and also meets their different peer review organization or quality improvement organization criteria. So another important thing that I want to cover, I'm going to try to do this correctly. There's a handout that is not here. It's on the app. And so you probably cannot read that because it's very tiny. There's a lot of information. So if you have the app, you'll want to navigate to this particular session, and you will have a copy of the PowerPoint slide as well as this particular document. I'm going to zoom in and attempt to discuss or just briefly go over. I don't want to read to you all, but knowing that you all don't necessarily, I see a lot of smartphones, so you can pull it up. In any event, this is a technical assistance document that will go over the different state agencies that are in existence that we have that we were able to survey, and it identifies what different services they're able to offer based on different ages. So we've got the agency for, let's see if it'll let me scroll. So we start off with the Agency for Healthcare Administration. And from birth to 3 years old, it goes through a whole listing of different services, a lot of therapeutic things, not therapeutical, I'm making up words now. So next, we've got APD. For individuals that are under 21, the extent of the services that are primarily available is waiver support coordination, and if it's someone that's in a family home setting, it's respite. If they've turned 18 and they're in care, then we're able to offer residential habilitation. And this goes into what was mentioned earlier, where there was something about the turning 18 and being able to offer waiver enrollment and provide services that we're going to talk about in a little bit. We're not there just yet, but so you know, we are able to offer those different services. And then there's mention of the Department of Children and Families foster care system. We go to Department of Education. Let's scroll down so you can see. So we've got VPK. We have transitional services. We also get into the Department of Health. They offer children's medical services. So the takeaway from this should be there's a lot of different state agencies out there, and there are a lot of different services that are available. And this was our best effort to try and outline what the different services are. So if you're able to see a service on there that you think one of the children that you're working with would help them, then you'd want to make contact with that particular agency and see if you're able to get that service in place. So returning to the slide, minimize this. All right, I did it successfully.
All right. So I saw a lot of jaws drop when you saw our waiting list, and we've had a few questions about kids in care in the waiting list. So I did want to share with you, we've been very happy. About 2 years ago, and maybe before that because there was some proviso, the legislature amended Chapter 393 of the statute, and it gave us some law that helps kids in foster care on our waiting list. And so basically, when kids are in foster care and they're adopted, reunified, or achieve permanency, instead of staying on the waiting list, they can be enrolled on the iBudget waiver. Also, when they turn 18, if they're still in foster care, they can be enrolled on the iBudget waiver. So we really like this legislation because the piece about automatic enrollment with adoption, reunification, and permanency, that will help support kids. So if a child is adopted, they go back to their family home. So what that would look like is they're still getting all those Medicaid services we talked about, but then we could help with a little bit of respite. Or maybe the child needs a home modification, something like that. We would all be working to support the child. And then the legislation about kids turning 18. I think this is also very important because what this legislation does is it allows kids who turn 18 in foster care to get services from both APD and extended foster care. So extended foster care services for kids with disabilities is available from age 18 to 22, and they automatically get it unless they choose to opt out. So it's good to know this because kids can benefit from both programs at the same time. There was also some additional legislation, and in the event a person turns 18 in foster care and happens to be in a residential facility, the language allows our agency to pay for their residential habilitation when they turn 18. I saw a question back there. Okay, that was an excellent question. She was asking about crisis. If someone is in crisis, right now they can be enrolled onto our waiver program. Crisis in a nutshell is people who are homeless, a danger to themselves and others, or their caregiver is unable to provide care. But because of this legislation, typically a child who's already in care may not need to apply for crisis waiver that you were mentioning because they can be automatically enrolled in these circumstances. Now, kids who are on the brink of going into care that are not yet in the foster care system, often they do meet crisis criteria, and we would like to help avert the crisis with waiver enrollment when we can.
So not to belabor the point, but in some of the conversations that I had yesterday and earlier today, it's definitely noteworthy to say a client, an individual, they do not need to opt out of extended foster care in order to get this enrollment at age 18. For whatever reason, I don't know why, but some people think that that is the case. It's not the case. They do not need to opt out of extended foster care for the statutory criteria to be met in order for them to get this enrollment that we've just talked about. So looking at iBudget waiver services and also child welfare services. So here are 3 particular living settings. We've got a residential facility, family home, and a supported living type of environment. And below, we're identifying, well, what are the different services in particular that our agency would be able to offer? So earlier I talked about waiver support coordination. So waiver support coordination is a mandatory service for all individuals that are enrolled in our program. The whole idea behind it is our program, all of the programs are kind of confusing, and so the support coordinator is supposed to be an individual that can help the client, the client's family members, circle of supports, help them navigate the system. And so throughout all of these, you'll see that waiver support coordinators are involved because it's a mandatory service once you're enrolled in the iBudget waiver. So once an individual is in a residential facility, following that statutory criteria, when we're able to offer enrollment and bring them onto the waiver once they're 18, then the waiver would cover ResHab. The remaining service needs while the client is in the group home facility would be met by a combination of community-based care organizations or Medicaid state plan or Medicaid fee-for-service benefits. In the family home, if permanency is achieved, there would be that support coordination, and we're also able to offer respite services. And respite is something that occurs until an individual reaches 21 years of age. And the reasoning behind that is Medicaid state plan covers personal care assistance. Respite is for a temporary break. Personal care assistance is to address ongoing activities of daily living, instructional activities of daily living, working on those different tasks associated with ADLs and IADLs. So beyond the family home, we also have a living setting that's known as supported living. And this goes in line with the whole idea of we want our clients to be in the most least restricted environment possible. This probably also goes in line with the whole purpose behind extended foster care, where we want to have these youth move forward and be in this supported environment. So supported living, which exists within our agency and also within extended foster care, the purpose behind it is to allow a client to live in a community-based setting in their own home, in their own apartment, rent a house, they have their own lease, and then they have a supported living coach. And that coach provides specialized services where they're able to do things a little bit more than what a personal care assistant or personal supports type of worker would do. They have this additional training where they work on assisting a client with paying their bills, assisting them with working on a budget, things of that nature. And so that's something that's been very successful that we've seen. And if someone is going into our program when they hit 18 and also getting the benefits of extended foster care, I imagine there would be a great deal of collaboration between the services APD is able to offer as well as the services that the CBC through DCF is able to offer.
I have a quick question. Do you have any actual facilities that are supported living? Like they're actually fostering independence, but they're not quite ready to go get their own apartment? And if they're aging out of foster care, they don't have a place to live with them. So that's my problem, is kids aging out, they're higher functioning. Where do they go? Are there places that actually provide those wraparound supported living coaches?
The model for supported living coaching is there's not an actual facility. It's choice driven, so the coach would work with the client to identify different housing options. So what would probably be helpful is if there is a client that's high functioning to bring this up in the different transitional calls that can and should be occurring with the local APD office and raise that as an issue, because we would much rather have a client go into the least restricted environment than in a more restricted environment of a residential facility.
Don't they also have to be within a certain number of months of living independently before they can get certain services to help them live independently? It's kind of a catch-22.
So there are specific coverage and service limitations that are set forth in our iBudget waiver handbook. But for the supported living coaching service, you're able to, or clients able to receive the service up to 90 days before they actually move into that independent living, or rather supported living environment. And so that helps, and that does a lot of the legwork to try and find a particular apartment or home to rent. So yes, there are service limitations, but there is flexibility within the rules as they're written to account for that, to help find something. Yes, sir.
Is the supported living coach an employee of APD or a third-party provider?
We have a very vast provider network. None of them are direct employees of our agency. They're all contractors, subcontractors.
Have you ever solved finding them same similar problems that you're having with behavioral?
No, we're not actually, not in this part of the state. What we've done, because our agency, we've moved towards this open enrollment process where people that want to become a provider have to apply within like certain timeframes, and the rules allow us to offer enrollment to providers outside of those timeframes for specific critical needs services. And I'm not aware of supported living coaching as being a critical needs service at this point, based on a huge provider shortage. I don't think we have a shortage of that at this point.
Why do you have the shortage of behavioral assistance? Is that because they don't accept the reimbursement rate, or because there's just a shortage of those professionals in the county?
I don't have enough information to answer that.
I'm not sure that it's a reimbursement rate issue. There's a lot of different organizations that offer behavior, but I know that in terms of the Medicaid program, they're just trying to onboard a lot of existing APD providers. So there could be a lot of different factors, but the universities in the state do produce a lot of behavior analysts, so we hope that they will be able to enroll quite a few.
All right, so now let's move into our first case study. And this is the interactive portion where I'm going to read the case study and see what you all think. So in this situation, and there are actually treats as well for participating. So in this situation, we have a 16-year-old with cerebral palsy that has recently been removed from the family home where he resided with younger siblings and a single parent. He has severe physical limitations and uses a wheelchair, requires lifting, and relies on others for all aspects of daily living. He's developed pressure sores and other health complications due to the lack of physical support. The parent left the child home alone or in the care of other younger siblings and is now working towards reunification. So with this in mind, what services, who would you reach out to? What do you see as ways to help this child? Does anyone want to start?
Do you know if he was receiving any services at the time, any therapies?
For the purposes of this, let's assume no. Let's assume that this is a child who has Medicaid and they're not getting any services. You, ma'am.
File an APD application.
Okay.
Advocate that this is a crisis and who's going to be removed from the home potentially, and start getting services that way. Maybe, and then look for the services of it, but I would push the application and advocate for the fair.
Okay. And I think that's really a great first step, because First, you want to know, does this person, are they a client of the agency already? And if they're not, you want to make an application because, as you've all found out, there's this huge waiting list. But one of the other wrinkles there is this child has Medicaid. And so with that Medicaid, there would be the potential availability of supports and services through those Medicaid benefits, such as there could be therapies. There's a pressure sore. That pressure sore might require skilled nursing services or private duty nursing. That's something that Medicaid state plan offers. Because of those physical limitations that require assistance with lifting, that might be a reason why Medicaid state plan would authorize personal care assistance. And that would be something independent from what the Agency for Persons with Disabilities would be able to assist with. And that's kind of why we wanted to lead with this, because initially a lot of people think we got to go to APD. That's helpful because we want to get the ball rolling there, but at the same time, there are other agencies that can provide assistance to help maintain that particular living setting in that situation. Yes, sir. I'm sorry?
Wouldn't the child, unless the child wanted a relative, go to be placed in a medical foster home under this factual situation?
Depending on the we didn't really dive into the severity of the pressure sores. I mean, if it required skilled nursing, then yes, I would imagine they would have to go to a medical foster home. Depending on the severity of whatever injuries that developed, yes. And then I think part of it is deciding or analyzing, all right, what are the next steps? Who has the availability of services that we need to reach out to either get this child back in the family home, or if that's not going to be a safe or viable option, what are next steps? Does anyone else have any thoughts or anything they want to add as it relates to this first case study? Yes, sir.
The issue I run into is usually in this case, they're moved several counties away, because that's where the facilities are, and then the coordination and whether they're gonna go back to that county to start with causes all kinds of issues.
And so,
Deal with that, I guess, is the question.
right, and I think that is a very difficult situation because if someone has to be removed and there are only so many facilities and there's only one particular facility in this geographic region that can handle medically complex or medically fragile children, I think it goes into the idea of, all right, that might have to happen temporarily and then work towards getting whatever wraparound services are available so they can go into the home so that way that home environment will be capable of accommodating the child's needs.
And I guess the question becomes, what home?
Well, I think the primary goal would be the family home if we were able to, well, if everyone determined that it would be safe, but if enough services were in place. Okay. So, very briefly going over what DCF, through their foster care system, is able to offer. In my mind, I kind of actually go back to when you all went to the keynote speaker with Matthew Dietz, and he was talking about dogs and the therapeutic value that dogs can have. And there was a question raised about, well, who would pay for the dog food, or who would pay for all these different things? I distinctly remember him saying the CBC. So I'm going back there. I heard it.
You need to add dog food to the bullet.
So we're adding that to this bullet. But that's noteworthy because for individuals that are under 18, or just children in general that are served through foster care, there are a lot of different services that the community-based care organizations provide. And that's something where, for kids in foster care, the CBC is the primary. And Lorena talked about that earlier, and that's where we all look to first as a starting point, and then we go from there to see what other sister agencies are able to offer. And unfortunately, there's a lot of magic numbers, age changes that come into play. So we talked about turning 18. Well, that's not an unfortunate, because once someone turns 18, if they meet the statutory criteria, we're able to offer waiver enrollment. There's age 21. That's a magic number because that's when children will age out of many Medicaid state plan benefits. We've talked about the different therapies. We've talked about personal care assistance or private duty nursing. That's available to children under age 21. Once they hit 21, there has to be another coverage source because Medicaid state plan's not going to cover it. Well, our waiver covers it. We talk about age 22 is also a magic number. That's because that's when an individual will age out of the public school system. They're not going to have this meaningful day activity that they were receiving before. So who's going to fit that need? So those, when we look at the needs of these children and the needs of the child, we also have to take into consideration what's their age, where they are, and also what they want to do, because we don't want to put them in a situation that goes against what they want. All right, so next slide.
So at APD, we receive a lot of calls asking us to place kids in one of our licensed facilities. We do have 1,700 facilities that we license statewide. Most of them serve adults with disabilities. APD is not a placement agency, so I wanted to kind of share the message. While there are occasions where sometimes a child is in one of our APD licensed residential facilities, it's typically not the best placement. Our licensed facilities typically have shift staff, particularly for young children. There's not a lot of opportunity to develop parental attachments and things like that you would receive in a traditional foster home or with the family, if we can preserve families with supports. So what I would say is if you're working with someone and residential placement comes up, before that option is explored, we hope that you will explore all of the other services available and see if those will meet their needs before getting to an APD licensed residential facility. So for example, Michael was talking about the child with cerebral palsy. Medical foster care, that's more of a family-like setting. Medical foster care is really great because it's a family that's specifically trained to meet the medical needs of the child, and then when the child achieves permanency, ideally the medical foster parents can train the birth parents. So that's a lot less restrictive. Or when you're working with kids to keep them in the family setting, sometimes if Medicaid can pay for that 24 hours of nursing or 12 hours a day of personal care, it'll preserve the family unit. So we want to make sure that all other available resources would be explored before looking into licensed placements. We do recognize that there are some kids that have some significant challenges, and there are times where a placement might be appropriate, might be the best place for someone. In these situations, I wanted to throw out a couple things. In APD licensed facilities, we are only allowed to house individuals who have a developmental disability, as we were defining under the statute. And the other thing I say is our facilities, they are private entities. They're Medicaid providers typically. They're not APD run. At the same time, we would ask that people go through our APD referral, residential referral process. In each of our region offices, we have a placement coordinator. And what that person can do is receive information about the needs of the person and help search for the best placement. They should also be helping to make sure all the wraparound services were explored. But it's really important to go through our residential planning process, and the reason is because we want to make sure that when somebody is placed, that the place they go is a good match. So you don't want to have a home that has children and adults. You don't want to necessarily have somebody with severe behavioral needs in the same home as somebody who has a ventilator. So these people are really important in helping coordinate that. So please think about that if you are in a situation like that. Okay, we also have another case study. This is to talk about a 14-year-old who's in foster care, and this child is dually diagnosed with autism and schizophrenia. So right there, you can tell this person's got some challenging behavioral issues. They've been involved with law enforcement. They've lived in multiple residential facilities in the past, in and out of foster care, juvenile justice history, and they've assaulted caregivers in some of the places that they've lived, and have been discharged. So you're in a situation where you're trying to find a place for them to live. How would you approach this? Michael's got candy.
Well, first you're gonna need to see if they're receiving what type of behavioral services and the medical state.
Very good.
Behavioral challenges.
So she said, look for behavioral services from Medicaid. That's an excellent starting point, looking for the wraparound services. What else?
Also,
Yes, ma'am.
I would get a team conference together and get the doctors on board and see what's triggering the potential behaviors. And, I mean, that's gonna take everybody at the table to figure this out.
Excellent. She suggested a staffing. And some of the players that would be good in that staffing might be if they're on one of the Medicaid specialty plans, are they getting the mental health component from, they have schizophrenia and autism, so the behavioral services that she mentioned plus the mental health treatment that Medicaid provides is good. Yes, ma'am.
And also making sure the child has an attorney or special needs and child diagnosis with autism.
That's excellent, making sure they have the right legal representation. We actually see a lot of cases where kids don't have guardians that are getting in their upper teens and very good, looking at public school.
I would ask for an updated suitability assessment to see if he needs a higher level of care. Maybe interact with the DJJ folks to see where they're at, and some competency and that kind of thing.
That's very good, suitability assessment and DJJ information. Yes, sir.
Well, you probably want to look at what his status is as far as psychotropic medications, whether there's been a recent medication management, whether he's had a recent psychiatric evaluation, whether he's on the appropriate medications, whether he needs them or not, whether or not certain ones have been effective before or not effective, and make sure that there's a regular review of them, make sure he's receiving the appropriate medications, if any, that are the appropriate dosages.
Absolutely.
And has the child had a psychoeducational exam?
Yeah. Very good.
Is he a trauma-based kiddo?
The process of submitting an application to the agency to see if the individual is eligible.
Yeah. She said apply for APD services as well. So those are all of those are excellent. Yeah, but it may or may not have been an APD one, so. Oh, it does, okay, that's right, he was. So it is, sorry, Janet. So this is a child, they might be appropriate for an APD licensed facility. There might be a foster home. So if you think about it, I know people are like, oh wow, foster home, behavioral challenges, but sometimes if you can get all the wraparound things in place that you talked about, the medication management, the behavioral services, the school services, maybe a foster home would be more manageable. Sometimes kids that are in environments with a lot of people, become overstimulated. You never know. I think it's a good discussion, thinking about all of their available services, and don't just think licensed facility. There's lots of options. So we just kind of barely touched on education and transition services, and we could probably have 2 legal conferences for several weeks back to back and barely touch on the IDEA. But the Individuals with Disabilities Education Act, basically kids with disabilities are entitled to a free and appropriate public education. Under that act, they get the supports and services to the extent that it impacts their involvement and progress in education. So that means if they need some assistive technology, they need instructional aids, accommodation, special settings, they can get that in the public school system. That is done through the individual education plan, the IEP process. And so when the school does an IEP, which is at least annually, they should be inviting the child and guardians and whoever is involved in the child's life to do that planning. So that's something that, kids should be in school, and that needs to be explored. As you're working with teenagers, even the younger teens, it's good to start looking at vocational rehabilitation, or VR. So VR is a program that supports people with disabilities in getting jobs and keeping jobs. And VR has a number of programs specifically targeted to youth that are transitioning from the school system. They have a youth transition program and a STAR program, to name a few. What they do is they work with kids on career exploration. They do, sometimes they'll do on-the-job training, job skills, just kind of the gamut. When you're working with kids that have the more severe disabilities, sometimes you might have to push back because sometimes VR will say they're not employable or whatnot, but that is definitely something to pursue as you're working with teens. Question?
Maybe I was misinformed, but I was told that if you're an APD client, you can't work until 26.
That's not true.
So there's no age limit.
There's no age limit. There may be a minimum age, but they start in the teens at VR working with kids. When they're in the public school, when they're 14, part of the IEP process is identifying a course of study, and they decide if the kid's going to be on the regular diploma track or special diploma track, and that's usually when they start in the public school talking about employment type services. Yes, sir. So that's an excellent question. So they do have to maintain the financial eligibility for Medicaid. There are certain benefit ways people can manage their benefits to maintain their eligibility, but that has been a struggle for people that do want to work full-time in salaried jobs. Some states have gone to Medicaid buy-in programs. Florida doesn't have that yet. So, yes, ma'am.
Looking and reading the news, it looks as if Medicaid services may be dwindling to a certain extent nationwide. Have you all been talking about that at all, what we're going to do if that in fact happens to our state? Where are we gonna, where are our children and our adults going to get the supports that they need? This is political, probably.
Yeah.
Too much,
No,
but,
it's
you know,
fine. It's a
kind of
legitimate
different.
concern. Well, right now, there's a lot of unknowns and there's a lot of federal things going on. Even yesterday, I saw some big news. I think at this point, I know at APD, we're just trying to watch things really closely and keep abreast to what happens. And certainly, I know the state Medicaid agency at ACA would be vocal about the severe needs of people with developmental disabilities. But in terms of the exact, there's just so much unknowns, I wouldn't even begin to be able to know. All right, we've got another case study. This is a 16-year-old with Down syndrome, and all their caregivers died. And they really need to be placed in a family-like setting, and the child's incontinent and nonverbal. And this child goes to public school. So how would you approach it?
Well, one thing I think you should do, not necessarily related to the setting, the placement, but you will need an educational surrogate in place. Make sure he has an IEP, he or she has an IEP, and so make sure the educational rights are protected wherever he's placed.
Very good. Okay, and I know we're getting close to the time. Anything else? Would you work with VR?
Well, based on what you just said, yes.
Good. Yes, ma'am.
My piece is teachers, because the teachers know a lot, and they know about, because I've seen where teachers have actually come on board as the guardian advocate, and actually they be able to find somebody else in their class that is willing to keep them in as a family setting. You really have to reach out to the community, and you have to go where they know him or her, and try to figure out if somebody in the community would take it on. This has happened.
Very good. And the one thing I wanted to emphasize, a lot of times when you see a child that's incontinent, people immediately think they need to be placed in a facility. But, that is not the case. We would encourage more of a family foster home for somebody like this. May skip the next case study because we're running close, but Michael can talk to you really quick about some of the non-government resources.
Okay, so very briefly, and actually in the very back of the room, there are different handouts that you can take with you. And among them is a card that's the resource directory card, and it provides the link to the resource directory. And that's really what this slide is going over. So it's 35. There are 36 keywords that an individual can use to search through the resource directory. And the directory consists of various providers, faith-based organizations, just community resources that are out there that can be accessed. And this is a really good opportunity if you're curious of what's out there and what's available in your geographic part of the state to access, to look at and see, well, what is there? And for the last year, the most common search terms that were used were group homes, adult day programs, and independent and supported living. That helps us get an understanding of what is everyone that's coming to this directory, what is it that they're looking for, what are the common themes. So this might actually be something that's invaluable to you all. I know earlier we were talking about someone that was interested in going to like a camp activity. So those are many different service types that would be on there that could be reviewed and accessed. And also very relevant, a coming attraction. There is the Florida Navigator, which is a tool that our agency is developing to help everyone try to navigate through this nebulous system, because there are lots of different organizations, agencies that are involved as we're all trying to serve these children. And hopefully this is something that can streamline the approach that everyone's taking. And do we know the anticipated date? I think it's still to be determined, but it is in the works. And finally, you've been asking questions as we've been going along, so if you do have any questions after this, you can feel free to email myself or Lorena, and we'll do our best to answer, or if we don't have the answers, put you in contact with the person that can. So thank you all.